Well, that question has been investigated now for over close to 3 decades now, or at least 2 decades. There's been a lot of interest understanding whether sleep is from the brain for the brain, or whether sleep is from the brain for all the body. Seminal research around 2 decades ago demonstrated for the first time that people who are forced to sleep less than what their body needs, and these are young, healthy individuals, they can develop glucose metabolism problems. In essence, you can make a young, healthy, lean person in their mid-20s, early 30s, look like somebody whose metabolism is similar to somebody who's in their 60s and 70s by simply restricting their sleep for a few days. And since then, and that seminal paper was published by one of my colleagues and mentors, Dr. Ev Van Cauter, since then, there's been increasing interest as to whether sleep disorder breathing, especially obstructive sleep apnea, is also associated with worsening glucose metabolism and increasing the risk of diabetes or pre-diabetes in those individuals. So it's an area that's there's a lot of interest in, mostly because, at least if you just think about United States, we have around 9% of the US population, that's around 30 million or so, who have type 2 diabetes, and another 70, 80 million people who have what we call pre-diabetes. So that's a precursor. So people who have pre-diabetes are at very high risk of developing type 2 diabetes in a few years if they don't do anything. So just add up those two numbers, you get around 120 million people. That's a third of US population. And this, problem is not just an American problem, it's a global problem because obesity has been increasing around the world. So it's important to understand whether by improving sleep, whether we can improve risk of developing diabetes, and whether treatment of sleep apnea can actually improve diabetes control. That's kind of the basis of our research question, and that's how we got interested in this topic. One thing that we've learned over the years is that when we look at individuals who have diabetes, type 2 diabetes specifically, or pre-diabetes, compared to the general population, they have higher rates of obstructive sleep apnea. And study after study from a variety of countries has confirmed that. And it shouldn't come as a surprise, because people who develop diabetes tend to be middle-aged or older, and tend to be overweight or obese. So those two are also risk factors for sleep apnea, obstructive sleep apnea. So, but with that said, earlier on, around a decade ago, when people started looking at the actual prevalence of obstructive sleep apnea in people with diabetes, the numbers were quite shocking. And most studies suggest that anywhere between 60 to 80% of such patients with diabetes and pre-diabetes have obstructive sleep apnea. On the other hand, the great majority of them don't know they have it. And of course, if you don't know if you have it, you can't treat it. So I would say one of the major problems we have in the field is unrecognized and untreated obstructive sleep apnea in that patient population, those with pre-diabetes and type 2 diabetes.